Thank you very much, Saruchi. And now we will hear Lori Dorfman. Thank you, Lori.
Yeah, we did it with the fellas earlier. So we are good to go. I think we're good to go. We were good to go before, really we were. Okay, let's try this. There it is. Okay. And voila. Okay. Good afternoon, everybody. Did you all have a good lunch? Thank you, Arturo. And I am Lori Dorfman, as Arturo said. I direct the Berkeley Media Studies Group, and we are a public health group that has an interest in media. And the reason we have an interest in media is because when you study public health, the first thing you learn is that the best way to improve a population's health is to improve the environment in which they live. So if we want to do that, we have to think about how did that environment come to be? What are the rules that keep it that way? How do we change the rules if we want to? And most of our work is in the United States, and in this country, if you want to do that, pretty much you have to talk to decision makers, you have to talk to policy makers, and so that's what brings us to an interest in the news, because if we want to get the attention of policymakers, we have to pay attention to what they pay attention to. They pay attention to the news. So that's what brings us as a public health group to an interest in the news. So we study the news media to understand what's the starting point of the conversation. If the only way people got information about violence, for example, was from the news, what would they know? And of course, very important, what wouldn't they know? A lot of stuff we've been talking about today. So we do that, and then we take that and apply that research to our work with advocates so they can become stronger voices for policy debate, and work a little bit with reporters as well. And what I'm going to share with you today is some of the work we've done on various studies, and I want to acknowledge our partners, the Prevention Institute, their Unity Council, the California Wellness Foundation, also the National Sexual Violence Resource Center, and our co-authors here. And I've done a bit of a mashup today, if you will. Pardon me, I've got to get my water, but you guys will excuse me one. And I'll do my best not to spill it. Okay. Oh. So, I'm doing a mashup because I was asked to talk about some of our work on how youth and violence are represented in the media, and a little bit about our recent work on sexual assault. And we've been doing some other work on community violence and childhood trauma, so I'll kind of fold that in. So I'm going to show you data, but it's a little bit from here and there, although it is quite consistent. And so I'll draw those patterns and parallels for you as well. And the two studies I'm going to draw from most are available on our website, and I'm happy to direct you to that. I want to start out by talking about the news and a little bit about the functions of the news. And I'm going to talk about framing, which relies, I think, on some of the schema and scripts we've talked about earlier this morning, which was fabulous and fascinating, but just from a slightly different lens and slightly different viewpoint as we think about what the role of the news media is in this. And I know this is the Global Forum on Violence and Prevention, but I want to just caution you that the research I'm showing you is from news in the United States only. And because we're talking about social norms and how these get translated and reinforced in news, I think it's important to keep that in mind. And I'll be curious in our discussion if you feel that the kinds of patterns I'm going to show you here translate into other parts of the world. So, typically, the way people talk about how news functions in our society is that it doesn't tell us what to think, but it tells us what to think about. That's the agenda setting function. So if something is raised up, maybe there are all times refugees in the world, but today we're talking about refugees, partly because of the magnitude of what's happening, but also partly because of what's on the front page of our newspapers and in our news feeds and in our Twitter reports. So there's that aspect, but it doesn't just tell us what to think about. It also tells us how to think about that, partly because of the way news storytelling is structured. And it's structured in a very particular way that emphasizes some parts of the story and de-emphasizes other parts of the story that have a profound effect on our ability from a public health perspective to tell the whole story about what we think is going on, which is enormously important if we're trying to help policymakers understand what we need to do about it. So I want to show you how this framing thing works, and we've talked a lot about some of the schemas and things like that, but just to demonstrate for you that this is something that happens behind the scenes that you don't think about, that is influencing what you do, and that is influenced by cues around the environment, in the environment that you're exposed to. I want you to tell me in one loud voice what it says behind that orange box. Oh, that was weak, people. Let's hear it. Yes, that's what it says, except not so much. Look at that. Isn't that fun? Look what your brains did. Your brains took a tiny little cue, and you filled in the blank. You did not have, you didn't have to say brain. Oh, you like that? That's good. That's right. I have to, yeah, okay. I didn't make this up, I gotta say. But anyway, but it works every time, I'll tell you. Every talk I give, I put a different word behind that box. Works every time because your brains are so good at seeing letters, at interpreting. When you came in, even though the tables in this particular conference were arranged a little bit differently, so it kind of threw everybody, our social norms were interfered with there. We found a seat, we knew what to do. You all know to look this direction. There's a lot of things that are dictated by things we don't think about. And not just words like this, but stories too. They're little cues that set off whole schema, I want to use the word even though, theoretically I don't know if I'm using it right, that tell you what to expect in the world and influence what those expectations might be. So this is really important when it comes to news, because in news coverage, we have had a century or more of distortions about what violence is, what it looks like, how it's manifest, especially when it comes to young people and especially when it comes to people of color in the United States. And I can tell you it's 100 years, because when we did the study, we did a massive literature review about 15 years ago, and we updated it about 4 years ago, and we found no difference. And these are the key findings of that massive literature review. The first is that crime, especially violent crime, is reported out of proportion to its actual occurrence. This is hard for us in public health because we want to raise the alarm. When it happens, it's terrible. We want to do something about it. But it also makes a huge distortion of what people think is actually happening. So newspapers, for example, will generally report all the murders in their jurisdiction, almost none of the aggravated assaults, and probably none of the rapes. So this gives people a distorted idea of what the problem is. It makes it harder to fix that problem. News is reported as a series of individual events without adequate context. This is enormously important because it's the context where the prevention lies. And if we aren't embedding stories in that context, we're not going to be able to see the whole picture and what needs to be prevented and what we can do, to make prevention. This is important because the news media are the stories we tell ourselves about ourselves, and they are assumed to be true. So if there's something left out and not included, we're in trouble. Especially on television news, we find that the crime stories unduly connect race and crime, especially violent crime. There's varying research studies here that some of them conflict, but in general what they find is that it's usually, I was going to say African American, most of the studies are about African American and Caucasian. They don't have many studies of other races. There's a smattering, a few. What they find generally is that African American victims are underrepresented. There are some studies that show African American perpetrators are overrepresented, but there are some that there's a little conflicting work there, but it's really at the victimization stage. And then they also unduly connect race when it's mixed race crimes. So you see that as well, where you see African American perpetrators and white victims overrepresented. That's a huge problem if you have no other personal contact with violence. If the information you're getting about violence is from the news media, you have a distorted picture about what's going on, and it's really tragic when it comes to young people, because young people simply don't appear very much in news coverage. And when they do, in our studies, we have found that they appear in two spots in the newspaper, essentially. They appear in violence stories, and they appear in education stories at about the same rate. But almost every child's involved in education, and almost no young people are involved in crime. And so that's a huge distortion when that's been equalized. I've been told I have 5 minutes. This is going to go pretty fast. So what that means is, we have a misinformation synergy. We have a distorted view of crime, of race, and we have public opinion that reflects what is shown in news coverage, which makes it very hard to have a real conversation about what's going on. It means that we are out of balance. What the researchers call this is, when they're studying the news, they call it the difference between thematic and episodic coverage. And most news is episodic. It focuses on individuals. I call it a portrait. It focuses on an event or an individual at a certain place in time, and not the landscape, not the thematic news that embeds that individual in a context. And in research situations, what researchers have found is that when you show people episodic news framed like a portrait and ask them, what should we do about this problem, whatever it is, they will answer in ways that tend to blame the victim. That's bad news for us. Good news is that when they see news that is also thematic, it's still a TV news story, it's still a minute 20. We're not talking about the difference between a news story and a dissertation. It's still news. But when they see news like that and then are asked, what should we do about this problem? They answer in ways that include institutions and government as part of the solution. It's like going from a picture like this, and then you fill in one side and you've got just the individual, and you don't pull the lens back far enough to find out, is that child troubled because of the crowded classroom or whatever, and then we're completely out of balance. So that's the summary of news about young people. The other thing we have studied a great deal is sexual assault, and this is from our latest study. What it tells you here is that when you look at sexual assault, you've got about half of the stories about child abuse, about half of the stories about rape in adults. And the key takeaway from this study is that when you look at who's talking and what these stories are about, they are primarily about criminal justice. And we want to tip our hat to Shelley's former career, but can I call you Shelley? We've just met. But the problem here is that when we are just looking at crime and violence through a criminal justice lens, we're not really talking about prevention. So the idea that when prevention comes up, it's so far away from a public health context, that means the kinds of solutions we're suggesting simply won't make sense to people. And that has to be included as part of the discussion if we want to go a little bit further. When prevention is included, it's usually about community policing, and there are some great community policing programs. And there are some gun control policies, and there's changes in cultural norms and services for potential perpetrators. But most of the time when we're talking about addressing violence, it's from a criminal justice point of view, and it's about increasing sentencing and being more punitive. And that just makes it much harder for us to go, to get to where we need to go. So I want to just say one other thing before I have to wrap up here, and that has to do with language and how we talk about violence. And this has been very important in violence against women and how people have talked about that. So I'm going to skip this little bit about prevention and go right here. This is one of the things that has concerned people over the years about news stories about violence against women is that women have been blamed. And there's been news coverage of that, and that's not what we have found in our studies. What we have found, though, is language that minimizes the problem. So overt victim blaming is rare, but what we do see is language that minimizes the act of sexual violence and implies consent, so that you have statutory rape referred to as a sex romp. And what you see in the illustration there is Jared Fogle, who was a spokesperson for Subway sandwiches because he lost so much weight eating Subway sandwiches, they made him a spokesperson. And then he was arrested for child pornography and statutory rape. And this was an article that was on a Twitter feed that people shared, because the language difference here is subtle, but look at that headline. Ex-Subway pitchman admits to child porn, underage sex. She's crossed it out and written statutory rape. Later in the article where it says having sex with underage girls, she crosses it out and writes raping. So this is a big point of contention, and it's something that deserves more research and more attention. I have to wrap it up here. So the final, what do we do about this? And of course, there's a lot that we can help you think through on that score. But the summary is this. We want to make the landscape as vivid as the portrait for the news media, for each other, for when we're talking about this, so people can see what those connections are and where the prevention really lies. We have to illustrate the values when we're talking about this. I didn't go into this in this talk, but it's very important because values are where people connect. As researchers, we talk a lot about data. We put our hand on our hip and say, can you believe these numbers? And it just doesn't matter for most people. You have to say why it matters. Connect your values to your solutions and use your communication to support action. Thank you very much.